Hi, my name is Teresa Shannon. I'm the Nurse Unit Education Coordinator for 9 East and a member of the Small Talk podcast team. Our poster, From Lockdown to Listeners, the evolution of the Small Talk podcast. Podcasts serve as an education tool used to promote asynchronous education in a convenient and engaging manner for all types of learners. In 2019, an award-winning team of nurses and an innovation technology specialist collaborated to create the Small Talk podcast, which addresses interprofessional learning needs of the pediatric healthcare community. Small Talk was inspired by Boston Children's Hospital nurses identifying the need to remain current with pediatric research and evidence-based practices, to enhance clinical skills and knowledge across the pediatric healthcare spectrum, to improve communication and collaboration with interprofessional colleagues, to address psychosocial and emotional needs of pediatric patients and their families, and to understand patients' experiences from their perspectives. Small Talk's education objectives are to serve as an informal catalyst that promotes conversation and fosters relationships of cross disciplines throughout Boston Children's Hospital and beyond, to create opportunities for networking, collaboration, and knowledge sharing, to foster a broader sense of community and pride throughout the Boston Children's enterprise, and to enhance the quality of care provided to our patients and families. This education program can be best described as an interprofessional podcast that successfully evolved throughout the COVID-era lockdown. Podcasting provides accessibility to listeners at any time from virtually any location and allows them to learn at their own pace. During COVID, our team embraced social distancing and discovered the benefits of facilitating conversations remotely, recording podcasts via the Zoom platform. Our conversations with healthcare professionals from various disciplines helps to promote a deeper understanding of pediatric healthcare and its challenges and to enhance multidisciplinary collaboration. Podcast topics are relevant to nursing practice, and each episode offers continuing education credits for eligible nurses. Our team recruits experts throughout the Boston Children's enterprise to participate as podcast guests. The convenience of recording using the Zoom platform has enabled our guests working off the campus or at one of our satellite locations to participate. The podcast has established a supporting learning environment by fostering interprofessional collaboration, creating opportunities for networking and knowledge sharing, as well as promoting a sense of pride in being a member of the Boston Children's community. Marketing strategies were generated, and the podcast was promoted through various channels, including hospital social media posts, intranet web pages, and departmental newsletters. Some key points and program highlights for Small Talk include a listener base that has been steadily growing since 2020. Small Talk is now available to listeners beyond the Boston Children's community on a number of platforms. The Small Talk team received a national recognition, being recipients of the American Nurses Association's 2023 All-Pro Nursing Team Award. In addition, Small Talk is providing education that is accessible to staff on demand, allowing them to learn at their convenience. It offers continuing education credits to participating nurses. It delivers timely and relevant information on various aspects of pediatric healthcare, such as clinical practice, research findings, and emerging trends. Small Talk features interviews with pediatric experts from multidisciplines that provide diverse perspectives and promote collaboration and communication. We discuss case studies and practical examples to aid staff in improving their clinical skills and knowledge in various aspects of pediatric healthcare. Our podcast addresses psychosocial needs of pediatric patients and their families by discussing topics such as family-centered care, cultural competence, and coping with illness. Small Talk provides insight to help staff develop leadership and management skills necessary to improve patient care outcomes and work efficiently. Small Talk team continues to create and disseminate nurse-led pediatric-related podcast content and promote cohesive sense of community throughout Boston Children's Organization and beyond through the art of conversation. The team captures analytics and evaluation data to drive topic selection, improve podcast, and expand their network. Next steps for the Small Talk podcast team are to explore potential quantitative outcome measures that demonstrate the podcast's efficacy in improving learning outcomes for its listeners.